So I'm Cheri Frey. I'm a board certified dermatologist. I practice at Howard University in Washington, D.C. And I still see patients, but I also serve as the residency program director. So responsible for training the residents and selecting residents. Also some medical student education, and then the Skin of Color Fellowship research director. So we have a one-year research program for medical students or recent graduates who are interested in dermatology research, and specifically in diseases that Blacks or Hispanics carry the burden. So HS, alopecia, we do vitiligo, a number of things. So for dermatology, we're a relatively small specialty. So our medical specialty focuses on hair, skin, nails, and mucous membranes. There are just over 12,000 practicing dermatologists in the US, and only 3% of them are Black. So it's a huge disparity with regards to how many practicing Black dermatologists there are in comparison to the percentage of Blacks in the US. And so, as you can imagine, that also has an impact on the care, the quality, and the access to care. Well, just in general, we know that when we look at, for instance, research funds or research interests, they are disproportionately going to conditions that affect usually Caucasian populations. And so there's a difficulty with interest in studying those diseases, but then also in research funds. And then just access to dermatologists. There have been some studies that show patients are more satisfied when there's race concordance in their medical visits. Specifically, we talk about hair, which is something that's very unique to different racial and ethnic groups, hair care practices, and also skin, right? That's how we are often separating ourselves is based on our skin tone. So you can imagine in dermatology, the disparity is quite significant because people just tend to feel more comfortable talking and getting advice from people who either experience some of the same things that they do or can relate to some degree. So we're working to try to improve that, both access to care by putting dermatology clinics in areas where there are none. For instance, in Ward 7 and 8, there were no dermatology clinics there. There's a majority Black population. It's been chronically underserved. So Howard University has a dermatology clinic there to help bring access to dermatologic services in those neighborhoods. So hidradenitis suppurativa is a chronic and can be an extremely debilitating inflammatory condition of the hair follicles, specifically affecting areas like under the arms, under the breast for women, the groin and buttock areas. And it does tend to sometimes run along with more cystic acne or other conditions of the hair follicle, like dissecting cellulitis of the scalp or pseudofolliculitis. So there's something about the hair follicle, and to be honest with you, a lot of research is going into to try to figure out where this inflammation starts. And we know that, unfortunately, we see it more commonly in Black patients. And so we're trying to figure out, is there something unique? We know our hair follicle morphology is very unique. And so does it have to do with the hair follicle morphology? Are we looking more at a genetic predisposition? We tend to marry and procreate with people that look like us. So there are a lot of unanswered questions. As far as how many people have it in the US, it varies by race. If we're looking at the US population in general, then we're probably looking at somewhere around 0.5% of the US population. But as I said, Blacks tend to have HS more frequently. And so their rates are usually around somewhere between 1% and 2%. So doubled or even tripled that of the general US population.
So
I wanted to say too, it's not just that it's more common in Black patients, but it tends to be more severe in Black patients. And so that's also an important distinction because all things being equal, those patients tend to see themselves in a more chronic and debilitating state, which leads to more ER visits, more hospital stays. And then it also is time away from work, time away from family. So the severity being higher in Black patients is just as important and significant as the rates being higher.